say this. I think you can expect us to be heading north, perhaps, and perhaps west as well.
Well, can you give us a hint? Because I may need to warn the citizens of the town.
Yes,
before
you may. Maybe in the state of Texas. How's that?
West in Texas. Okay, let's see. So
We'll
you were
see.
last in New Orleans,
Right.
so I'm guessing Houston. That's going to be my guess.
That may be. You'll have to stay tuned. See, you'll have to stay tuned.
I won't know till I actually see the video.
Yes, well, you'll be as surprised as our viewers.
Well, I want to thank you again. It's been fantastic. You're doing such outstanding work. I just can't believe people open up to you the way they do. And of course, we're going to have you back down the road, and we'll do some more of these clips. After the break, we're going to be back. And of course, today's topic is trichotillomania, and we will have a wonderful guest who will tell her story. Stay tuned.
If you or a loved one is experiencing depression, anxiety, or bipolar disorder, there is help locally. Bridgeway Psychiatric Center offers a day treatment program that combines medication management with psychotherapy to decrease symptoms and help clients get back to the things they enjoy. If these symptoms describe you or someone you know, Bridgeway can help. Bridgeway Psychiatric Center provides effective treatment without the confinement of a hospital. For more information or to schedule a confidential screening, call 562-0211.
At Memorial, we get that women are different and that you have special needs and wants, like modern birthing suites, the latest breast health diagnostics, advanced neonatal care, and other women-specific services. As a mother, daughter, sister, wife, and grandmother, you have many roles in life, and so should your health care. That's why there's Lake Charles Memorial Hospital for Women, a special place that understands your life. We are Memorial for Women.
Have you gone from being someone who was productive and happy, who enjoyed life and time spent with friends, to a person alone and confused? You can turn it around like others who have gotten help.
Have you or a loved one become addicted to pain pills or other opiates? If so, Behavioral Health Group's Lake Charles Substance Abuse Clinic can help. Please call 337-433-8281 to schedule a confidential appointment.
Welcome back. My next guest is Catherine Ozen. She suffers from trichotillomania. Catherine, welcome. So glad for you to join us.
Thank you so much.
How are you doing today?
I'm doing okay, and yourself?
I'm doing great. So, all right, so you have suffered from trichotillomania for years. Tell us about when the problem first started.
Well, it first started when I was about 7 or 8.
Okay.
I was outside playing with a ball, and I had managed to pull all my eyelashes, all my eyebrows.
Oh, wait. All right. Say that again.
I was outside playing with a ball.
All right. You pulled out all of your eyelashes and your eyebrows.
Everything. And I went inside, and I was crying hysterically, and I told my mom that they had fallen out, which they didn't.
Right.
But
which your mom obviously knew.
My mom knew.
My mom eyelashes and eyebrows don't just fall out magically.
No.
That probably is not the case.
So she really didn't, she had no idea what to do with me.
Do you remember at that point having any type of urge or thought or feeling, anything that happened? I mean, what triggered that?
Sometimes I think it was the death of my grandfather.
Okay, so you had a stress in your life.
It could have been that, and we had moved from Chicago too, so I had left all my little friends behind. Okay. So I kind of worried, you know, a little bit about that.
Right. So let's trace it going forward. Okay, so this happened when you were young. What was next?
The next thing, we went to several doctors, and nobody could figure out what was wrong.
Were you continuing to pull during that time?
Oh, yeah,
okay.
Absolutely.
So once it started, it was...
It never stopped.
Every day?
Every day.
And then, so first eyebrows, eyelashes, then your hair on your head?
Then it started on my hair.
And what was this like in school?
Oh, school was horrible. I mean, school was a nightmare.
I can only imagine.
I completed high school with just a regular diploma like everybody else gets.
Did you wear a wig?
Oh, I wore a wig for probably 10, 12 years.
So I mean, I'm just thinking, and for those of you out there, if you can imagine how difficult high school is anyway with the peer pressure and the things that are going on, now think about the fact that you have no eyebrows, you have no eyelashes, and you're having to wear a wig. I mean, and kids are not nice. I mean, kids can be cruel in situations like that. But you did finish school.
I did finish school. I graduated with a regular diploma.
And what were you thinking at that point? Were you thinking this is never going to go away?
I knew the problem would be with me forever. And when I met my present husband, I had stopped wearing the wig after about a year that we were together.
Yes.
And it had grown out just enough.
This is before you got married?
Oh yeah, that was before I got married.
Okay. So he obviously accepted you for who you were.
Oh, absolutely. He stood behind
you got a good man.
I do.
Yeah.
I'm very, very lucky.
So you had accepted the fact that this was your life. This wasn't going to change. You had been to doctors. Did anyone diagnose it? Did they say, hey, you have trichotillomania?
There were probably about 3 or 4 different doctors that I had seen after probably having the disorder for maybe 5 or 6 years. Okay. Somebody had finally came up with a name for it. With a name
for it, and you say, okay, I know what I have, but what does that mean? Is anybody going to help me?
Every kind of medication you could possibly think of I took.
Okay, and nothing worked?
No, nothing worked.
Okay. Now, obviously, everyone is seeing you now and going, well, wait a minute, you have eyebrows, you have eyelashes, you have hair. So what happened?
Well, I started going to a nurse practitioner, and I had been on Depakote for probably a good 10 or 12 years. Okay. And she had mentioned I had just finished finals in college, and she had said, let's change the medication. Okay. And I really, really, really did not trust in that. I wasn't sure it was a good idea.
Okay, so you were saying, look, I've been through this route before. We've changed meds over and over. Nothing works. Why should we change?
Yeah. And, you know, she said, you know, let's try something new. And she put me on Geodon. Right. And within 2 or 3 weeks, I completely stopped pulling out my hair.
Well, that is amazing, because actually Geodon is not known as a treatment necessarily for this, but I mean, these new drugs that are coming out, we're finding that they work for a lot of different spectrum of disorders across the board. Well, and you know what? I think that what I will emphasize here is the key point is that you never know what med's going to work. You have to try and try and try, and eventually, for most of these psychiatric conditions, you find something.
Absolutely, and
works.
She did. She found it.
Yeah.
And it's
fantastic.
It's been since maybe the week of December of last year that I haven't pulled my hair out at all.
So we have a break coming up, and then we will talk to the founder of a national organization for trichotillomania right up after the break.
Tell Dr. D asked you to talk back America with Catherine Shreves.
What is trichotillomania?
Oh, I don't know. You got me. Is that a trick question?
Do you know what trichotillomania is?
No.
Any guesses?
Trichotillomania.
That sounds like some type of Halloween prank dealing with spiders and witches.
Sounds like some kind of medical condition.
Trichotillomania?
Have you gone from being someone who was productive and happy, who enjoyed life and time spent with friends, to a person alone and confused? You can turn it around like others who have gotten help.
Have you or a loved one become addicted to pain pills or other opiates? If so, behavioral health groups Lake Charles Substance Abuse Clinic can help. Please call 337-433-8281 to schedule a confidential appointment.
At Memorial, we get that women are different and that you have special needs and wants, like modern birthing suites, the latest breast health diagnostics, advanced neonatal care, and other women-specific services. As a mother, daughter, sister, wife, and grandmother, you have many roles in life, and so should your health care. That's why there's Lake Charles Memorial Hospital for Women,